Anterior aspect elbow joint. The examination position for the anterior aspect elbow is with the patient sitting in a chair, the forearm touching the floor, supination, and the elbow joint extended. Ultrasound examination of the elbow joint is performed by moving the foot from the proximal part to the distal part in a transverse view. In the distal anterior part of the upper arm, the biceps brachii muscle is present on the surface, and the brachialis muscle is present on the deep part. The brachial artery and the median nerve are observed on the medial side of the biceps brachii muscle. In the case of a brachialis and the biceps brachii, it is not easy to differentiate them just by looking at the muscle themselves. However, by tilting the foot slightly, the difference in the ultrasound shadows between the two muscles can be clearly observed and distinguished. Additionally, in the case of a biceps brachii, it is easy to distinguish because the brachial artery and the median nerve are located on the medial side. Also, if we find the musculocutaneous nerve that runs between the brachialis muscle and the biceps brachii muscle, you can see that the superficial layer is the biceps brachii muscle, and the deep layer is the brachialis muscle. Move the probe downward and look at the ultrasound images at the articular cartilage level of the elbow joint, looking from the medial to the lateral side. The first one is the pronator teres, the median nerve, brachial artery, and brachial vein. The biceps brachii muscle is observed in the lateral part of the median nerve and brachial artery, and the brachialis muscle is visible in the deep part of the biceps brachii muscle. The landmark is the brachial artery. Centered around the brachial artery, the median nerve is located on the medial side. The biceps brachii muscle is located on the lateral side. And the brachialis muscle is located on the deep side, and the brachioradialis muscle can be observed on the lateral side of the biceps brachii. Radial nerve is located between the brachioradialis muscle and the brachialis muscle. The longitudinal examination of the anterior aspect elbow joint starts from the medial side and then move the lateral side, observing from the humeral ulnar joint to the radiocapitellar joint. The humeral ulnar joint, the median nerve, brachial artery, and tendon of the biceps brachii, superficial radial nerve, and the radiocapitellar joint are arranged in the parallel, so each structure must be found by moving the probe in parallel from the medial to the lateral. The longitudinal ultrasound image of the humeral ulnar joint and the radiocapitellar joint are as follows. On the medial side of the elbow joint, the humeral ulnar joint consisting of the triangular shaped coronoid process of the proximal ulna and the humeral trochlear is observed. And the lateral side of the elbow joint, the radiocapitellar joint consisting of the square-shaped radial head and the capitellum of the humerus is observed. Biceps brachii. In the elbow joint area, it is recommended to inspect the three joints: the low muscular tendinous junction, and the distal tendon, and the distal anthesis. If possible, it is best to divide this part of the biceps brachii into short head and a long head. In the distal part of the upper arm, the biceps brachii arrange horizontally, with the short head on the medial side and the long head on the lateral side. The distal biceps brachii tendon change from horizontal arrangement to vertical arrangement as externally rotated 9 degrees. The short head of the biceps brachii is attached to the distal deep part of the radial tuberosity, and the long head is attached to the proximal superficial part of the radial tuberosity. In the shoulder joint, even if the biceps tendon is completely ruptured, it is mostly treated with conservative treatment. On the other hand, a complete rupture in the elbow joint may require surgical treatment, so careful ultrasound examination should be performed. When examining the distal tendon of biceps brachii in the elbow joint area using ultrasound, there are anterior, posterior, medial, and lateral approach.